You're watching Medical News Network. I'm Mike Wiggenstein. In studio today, we have one of Arizona's top cosmetic dentists, Dr. Paul Gebhart. Now, Paul, patients, are they mostly male or female?
Well, it used to be that they were mostly female, but now more and more men and female are getting veneers done. It's just a real cosmetic.
Are the patients older, or are they becoming older and older, younger and younger? How old's the average patient?
It's mostly, your 35 to 45-year-old baby boomers, but we're doing veneers on everybody nowadays.
Do you think a lot of people do it for their careers or for other reasons?
Your smile portrays a lot about you. When people walk up to you, the first thing you notice about them is their smile. It makes you welcoming and inviting. People want to look at somebody that has a nice smile. If you're at a restaurant and your waiter comes up and he has got a really bad smile, he's got a missing tooth or he's got cracks, you just get a visual thing about it,
Right. Yeah. No, I will tell you, that's a big deal to me. If the waiter or waitress, anybody that's in a customer service position that I'm dealing with, if they have bad teeth, and I don't mean to, but subconsciously, if they have bad teeth, they're not quite.
Perception. Everybody's perception is that somebody with a really nice smile is smarter, is cleaner, is done. You go on.
Let's take a look at some. Tell me about the first one here.
This is my first patient. She.
Well, that looks like a nice smile. It's pretty nice.
She's about 50 years old, and she's had some cracks in her front teeth. She has a crown that really fit very well. The porcelain quality was poor. It was incisal edge there.
Is she missing a tooth on the right there?
Yeah, she is missing one tooth, and she has some silver fillings in the back that show when she smiles.
So what did you do for her?
I ended up doing about working on 10 teeth here. I did a 3-unit bridge to replace the missing tooth. I did a crown to replace an all porcelain crown to replace the crown that was there, and then I also did 5 veneers in the area. Okay.
Now she comes in. You look at her, you decide what you're going to do, and then you brought a picture of her with her temporaries,
right?
With
her temporaries. This shows how she left. You can see that the edges are all more even.
Now, is this pretty much what her regular teeth are going to look like?
Yeah, to a certain extent, we were able to mimic the final product in the temporaries.
So she knows when she leaves basically what it's going to look like when it's done.
Yeah, I usually give the patient about 2 days of what they're wearing their temporaries. So if there's any alterations, something that maybe they want one tooth a little bit longer than the temporaries, or the shade. If the shade of the temporaries is a little bit too light or a little bit too dark, we can make those alterations before I send it to the laboratory.
So they actually get to wear and see what it's going to look like, and any changes they want to make, they can do at that point in time.
Yep.
Before the final
veneers
are made. All right, well, let's take a look at her after picture.
This is her after picture.
Wow, it's a big difference.
Yeah, you can see that the incisal edges are all lining up. The teeth are all the same color.
And it took you 2 weeks.
Completely natural. 2-week period of time.
That's incredible.
This is a 49-year-old man. He came to me. He just wasn't happy with the way his smile looked. He had a lot of old restorations in the front teeth that have kind of yellowed and aged, and they've gotten quite brown. Also, he has his incisal edges, or the edge of his teeth, is very straight across, and it kind of aged him. It made him look a little older than he really is.
And what did you do for him?
Well, I did 8 veneers on him, all the way from one side to the other. Got a nice, even look. We altered the incisal, or the edges of the teeth a little bit, gave him a little bit of curve to it, so it made him look a little younger. Also evened out the fronts of the teeth. His teeth before had quite a bit of, one tooth was sitting out, one tooth was sitting back. We were able to even that all out.
All right, let's take a look at his after. Wow, that is a big difference.
Yeah. You can see that, once again, got a nice, even look. You can see the color is very even. All the splotchiness that was there before.
He almost looks like he's better educated.
You know,
I mean, it makes a giant difference in how his appearance. I hate to say that, but
and he's even said that it just makes him feel so much better about himself.
Do you think a lot of this is being driven by the TV shows, the makeover, the extreme makeover shows on TV?
Oh, definitely. It's a craze right now. There's so many people.
I'm going to put you on the spot. What do you think about some of those?
Well, most of the time when myself and my colleagues get together, we'll look at a case like that and we see the person walks out, they've just gotten 10 veneers done, and everybody's clapping and they look great. But we look at the teeth and we're like, that just doesn't look natural. They look like horse teeth sometimes. And I'm sure that most people out there are saying the same thing.
It is. I will tell you, I watch it, and I'm not always impressed by the work they do.
And I think a lot of times they just, the artistry's not there. They're doing a great job of marketing, but you have to make the tooth look natural when you're done.
So somebody sitting at home right now watching the show, listening to what you have to say, what do you want them to know about veneers in particular, and about iSmile Dental? I did a little research on iSmile. I realized they're growing like crazy in Arizona. So what do you want everybody to know about them?
Well, veneers much easier than you would expect. Affordable for everybody. There's no reason if you're walking around out there, you're not happy with your smile, not to look into it at least.
And they can change your life?
Definitely.
What about people that have questions, concerns, maybe don't know what to do? Is there somewhere they can go? I mean, can they call you?
Yeah, they can call me. I'm always accessible. I want to be part of changing people's lives, and this is a great way to do it.
And what about iSmile Dental?
iSmile, we're a growing group of offices in the Phoenix area. We have an office over in Arrowhead Mall, one of the first dental offices in a mall. And we have everything available there. You can come in. If you come with somebody, we'll give you a pager. You can go shopping around at the mall for a little while. We'll buzz you when we're done. State-of-the-art facility, digital radiography, and it's a wonderful place.
Do you have the TVs?
Yeah, all the rooms have ceiling TVs.
So when I'm laying, I can watch the show?
Yep, hooked up to Dish Network. So.
All right, I want to thank you for coming in. You've been very informative. Welcome. You've been watching Medical News Network. I'm Mike Wittgenstein. For further information on this topic or any other, please visit our website at medicalnewsnetwork.info. Until next time, take care.